girl jealous, cause you sweet me past the looks. Show me your true color.
Thank you. Hello, judges. Pure Life Pharmacy is building the strongest first line of defense in healthcare for Africans by combining the power of technology and the penetration of community pharmacies. After working in healthcare for so many years, I realized that 1 in 4 Africans will do nothing about their health if pharmacies don't exist. Nigeria currently has 1 doctor to every 10,000 patients, and delay in access to primary care is resulting in 7 million preventable deaths annually. Doctors are migrating, hospitals are expensive, and the pharmacies that people have access to are not capable of diagnosing problems. If things don't change, there will be more casualty, as Africa's population is set to double by the year 2050. Thanks to our pharmacy platform, we are providing fast and simple access to the full range of primary healthcare services that Nigerians need. And how does this work? We have created an omni-channel, giving our patients an opportunity to choose between home care service, our online platform, and our physical pharmacy visits. We are aggregating healthcare providers, medication supplies, and logistic partners to provide an end-to-end patient journey with access to top-of-the-chain inventory pricings. Our services include telemedicine, integrative pharmacy, laboratory services, and subscription plans. That's not the best part. Our patients have access to their electronic medical records. We're interested in this $2.4 trillion market because Africa is not ready for the next pandemic or disease outbreak, with no capacity to churn out prevention, diagnosis, or treatment plans. Community pharmacies are also sitting on a gold mine of unused patient data, and we have an early mover advantage to manage primary healthcare effectively. We have established a proof of concept through our success in our 3 years of operations, where we have doubled our revenue year on year and are profitable, with over 8 states reached in Nigeria and 940,000 plus hours of patient time saved. Our audacious goal is to acquire 150 million users across 8 cities in Nigeria, in Africa, leveraging technology, and an 8% disability inclusion in our workforce. I survived a severe brain injury during my formative years, and my brother was born with a congenital heart disease. It was horror in my home growing up from this fragmented system. So this, for me, is personal. I want to thank our partners and my experienced team members for joining me on this journey to reduce death rates and to increase the access in primary healthcare for Africa's next billion people. Thank you.
13 minutes Q&A will start now. Judge Diane, it's your turn.
Congratulations on building a solution that is transforming healthcare in Nigeria and maybe in Africa.
Thank you.
My question to you, I think this business comes from really personal problem that you've lived through, and you've found a solution for many other people. My question to you is, I've seen in your financials that you have B2B sales, but also B2C.
Yes.
So I want to understand, where is it that your business is founded on? Is it B2B or B2C? Where do we have the best margins? And going forward, how do you see your business growing?
Thank you so much. So our business, our solution, is an end-to-end healthcare delivery service with a wide customer segment. And what this means for us is we have our B2B customers and our B2C customers. So for our B2B customers, we focus on SMEs and companies that cannot afford health insurance. So we run a subscription model for them, which is also another form of a revenue stream. We're not restricting ourselves to a transaction-based revenue. So with this, we're able to acquire users faster and not rely on one particular source of income. Now, we also have B2Cs, which accounts for over 70% of our customers currently. And with the B2C customers, payments are in time. And what this helps us with is B2Bs don't pay immediately. So for our B2C customers, it cushions our business, so we're not in debt and we're able to have good cash flow.
Very good. So Very good. So focusing on B2C, because in the end, it's the patient that has to
Yes.
get the right medicine. Great.
Congratulations, Mobolaji. It's always great to hear a founder's personal story and how it links to the problem that they're solving. I noticed that your gross margins have dropped.
Excuse me?
Your gross margins.
Okay.
They seem to have dropped from 60-something% to 48%.
Yes.
And can you tell us about what's going on? Why is your gross margin dropping?
All right. So that trend started around the end of 2023 when Nigeria started experiencing macroeconomics problems. The naira heavily devaluated, amongst other things. And it was in that same period that we thought to ensure that we democratize access. We're initially heavy on our brick and mortar pilots, but starting from the year 2023, where we thought to increase access, we had to hire new talents, get secondary partners to build in our technology, and that's why it looks like our growth margin, declined. But over the next 12 months, we're going to see an increase based off on more increase in our users and more reach in the states. So that was a building period, and with more acquisition, it's going to readjust over time.
Okay, now my second question, your business is doing a lot, right? You're doing, patient like EMR, you've got logistics, you've got B2C, B2C, B2B. It seems like you're doing a lot. What is your focus? What's the one thing that you do better than anyone else?
Okay, our focus is in the end-to-end journey, and I'll give an example. We have a frequent customer who walked in with his niece late last year, and she had a severe stomach ache. His journey was just to come into the pharmacy, pick a painkiller, and drop her back in boarding school. And on seeing this patient, she looked like she was in real pains. If they entered a pharmacy that didn't have our form of infrastructure, she may have lost her life, and this is how. We took her into our Minutes clinic, which has a telemedicine. We connected her with the doctor, and with the assistance of our nurse and medical devices, we ran checks, and we realized that she had appendicitis, which was about to rupture. And immediately, we connected them to our secondary partners, which was a hospital. In the next 12 hours, she got her surgery done, and her life was saved. So we're building an end-to-end patient journey that will reduce death rates, because 80% of Nigerians will go to pharmacies first. And if they will go to pharmacies first, we need to empower these pharmacies to properly diagnose their problems.
Well, as the only Nigerian here, I guess I can relate to some of what you've said. But last year at the ABH, our ultimate winner was a Nigerian and a medical personnel whose model is built around using the pharmacies, or the chemists, as we call them in Nigeria, the local chemists, to be the first point of response, which is exactly what you're talking about. In a sense, yeah, because you have more professional pharmacists there, but you also can't open a pharmacy store in Nigeria without a qualified pharmacist in attendance. So the question for me is, what is different between what you do and what Dr. Nato's company does? And one other question for me, you said 8 states. You already cover 8 states in Nigeria. I'd like to know how.
Okay. So Dr. Nato, big ups and respect to Dr. Nato. He runs a micro-insurance company. So what micro-insurance companies do is they are heavily reliant on pharmacies for their distribution. We are a pharmacy at core that then now aggregates healthcare providers to ensure that we provide seamless primary healthcare. And what makes it different is, one, we have access to medicines. We're able to knock off every form of middlemen. What this means for us is we have direct access to distributors and manufacturers. In fact, currently we have 3 exclusive rights to distribution, 2 in Nigeria and 1 for West Africa. So this is giving us the best pricings of medication with the highest penetration of access. Secondly, we are able to, so we run an omni-channel. What our omni-channel is doing is we are giving our patients an option. Nigeria is Africa in a whole is a hub for fake medicines. And patients need to feel, they need to see, they need to trust. And one of the problems that digital pharmacists platforms are having is there is no regulation to these medicines. We have control to how our medicines are imported, at least a high percentage of it. We're able to track the temperature in real time because the problem is not just fake medicines. The problem is also substandard medicines. That's why sometimes you have original medicines that still won't work for you because there's a way it is being shipped. So we have access to tracking our medication in real time from when it comes from our supplier up until it is in use with our patients. So we're able to give our patients this omni-channel to choose healthcare however they like. And our fulfillment centers, which is our physical stores, because sometimes it's perceived as though it's not asset-light. What our physical stores do for us is they also serve as fulfillment centers, and they serve as an out-of-home advertisement where we are continually building brand trust over time for our customers. So at our core, we are a pharmacy. Dr. Nato's company, respect to him, is ensuring that people receive care using pharmacies. So this is further to prove that pharmacies have always been a foundation of healthcare distribution. Health insurance companies also plug in with us. They use our pharmacies, our minute clinics, to aggregate care. We're also plugged in into e-commerce platforms like Glovo, like Mano, to ensure distribution.
I asked about the 8 states. I asked about your 8 states operation.
Okay, right. So currently, because we run an omni-channel, our fulfillment centers, our physical stores serve as fulfillment centers and warehousing. And for areas where our physical stores are not able to reach, we use our online platform. And we use our online platform by plugging in our other pharmacies' APIs, other healthcare providers' APIs on our platform for these deliveries. And for places where technology cannot reach, our physical stores can reach. And for places where neither can reach, what we are doing now is, in aligning with SDG goals 3, 5, and 8, we are dedicating 2% of our profit to CSRs, where we ensure that we take CSRs to this population that cannot afford our care. And whilst this serves us, this looks like impact, we're also aggregating data to build a business model around this population of people that cannot yet afford our service.
What would be your biggest challenge to growth?
All right.
Maybe I want to ask also a question around growth. Okay. Have you thought of franchising your model so you don't need to build physical pharmacies across the country? So you work with people, pharmacies who are working in the rest of the country, and they use your procurement, your technology, etc.
Yeah, so unlike traditional pharmacies, we are not building neighborhood pharmacies. We're building regional stores that also serve as warehousing. Ma'am, may you ask your question again? You asked the question.
No.
Around growth, how do you scale?
What would be your biggest limitation?
Okay, my biggest limitation. So we have we started this business 3 years ago, and we've bootstrapped up to now, and we've learned something. We've learned to do so much with so little. The biggest limitation for us right now is funding. Although we're exploring the bank of industry. Because we can get like low rates. We're exploring private equity companies, we're exploring venture capital, and we're staying investment ready. So one limitation is funding.
Okay, my last question. You are delivering care through your pharmacies. Can you talk about the regulatory rules that you are breaking?
Okay.
And
right. Whilst there's no...
What happens if someone dies in your pharmacy?
Okay, thank you. Thank you for that question. So whilst there's no single codified law for our solution, as I earlier explained, we're early movers. So there's no single codified law. But what we now do is we are registered with every necessary regulatory body. So what this means is for our minute clinics, they are registered with HEFEMA. For our pharmacies, they are registered with the Pharmaceutical Council of Nigeria, and so is our laboratory. So we are registered across these bodies. Whilst this is a challenge, because we're early movers, we're able to engage in stakeholder conversations that will create more awareness for these forms of solutions. Before we started this, pharmacies were not even licensed to give vaccination. But post-COVID, I came around, I saw what was happening, and spoke to one of our advisors, Professor Ayakora, who currently works with UNICEF and WHO. And he was very integral in changing that narrative. As we speak now, pharmacies are licensed to give vaccination across Nigeria. Also, we see hospitals not as competitors, but as collaborators. So we have also partnered, because they are healthcare partners, we've partnered with hospitals, we've partnered with emergency responses, such that when we see cases like the appendicitis, we quickly alert our emergency response, who takes them to our secondary partners that are hospitals.
We don't have enough time to ask you any more questions. Thank you very much for a good presentation.
Thank you. Great job.